Hello everyone. Today we'll be looking at the smoking cessation, the 5A's approach. I'll put a link to this document in the description below. This document is made by Nicholas A. Zwa, Colin P. Mendelson, and Robin L. Richmond. In this paper, this article is focusing on Australia, but we can still use some of the information here. So the 5A's approach to smoking cessation. The 5A's provide health professionals with a framework for structuring smoking cessation support. The elements of the 5A's are ask, assess, advise, assist, and arrange follow-up. Figure 1 shows this approach in detail. So look at figure 1 later. This is figure 1. The key features are, firstly, ask. Regularly ask all patients if they smoke and record the information in the medical record. This is what we normally ask in history taking, the social history. We always ask if you smoke and drink. So asking is the first step. Next, advise. Advise all smokers to quit in a clear, unambiguous way, such as, the best thing you can do for your health is to stop smoking. Third, assess. Assessment of interest in quitting helps to tailor advice to each smoker's needs and stage of change. Nicotine dependence should also be assessed, as this helps to guide treatment. So if the patient has nicotine dependence, you can help by giving one of the pharmacological therapies, which we might talk about in another video. They include nicotine replacement patch, other drugs such as bupropion, and another drug. So, assessment of other relevant problems such as mental health conditions, other drug dependencies, and comorbidities is necessary to develop a comprehensive treatment plan. Assist. Assist all smokers. All smokers should be offered help to quit. And lastly, arrange. Arrange follow-up. Follow-up visits have been shown to increase the likelihood of long-term abstinence and are especially useful in the first few weeks after quitting. When time is short, the approach of very brief advice developed by the United Kingdom National Centre for Smoking Cessation and Training Resources is an alternative. The steps for this are establish smoking status, ask, advise that the best way of quitting is with a combination of behavioral support and drug treatment, and refer, provide a referral to a specialized service. So this is in the Australian context, which doesn't apply to Malaysia, so I will not really go through it, but that's a helpline over here, and there's also an association which you can refer them to in Australia. So let's look at how to apply the 5A approach: ask, advise, assess, assist, and arrange follow-up. So in this figure 1, we can see how to apply all of this. So first, in history taking, you ask all the patients, every single patient you ask, do you smoke tobacco or do you smoke? And you record the smoking status. So it's smoker or non-smoker or ex-smoker or whatever. Okay. So the answer can be yes or no. Are you a smoker or are you not a smoker? So do you smoke now? So the answer is no. And you can ask, have you ever smoked? The answer could be no, means now he doesn't smoke and he has never tried smoking. So you tell him, you affirm the choice not to smoke and record smoking status. So you tell them, that's good, continue, don't smoke, don't start smoking. And if the answer is yes, so affirm decision to quit and record smoking status. So you tell them that you have made the right decision to stop smoking, and then you record him as an ex-smoker. give relapse prevention advice if he just quit within the previous 1 year, and ongoing encouragement for at least 5 years after they quit. So relapse prevention advice. Right. And then if you ask and then he says, yes, I'm a smoker. So you assess the stage of change. So in stage of change, you have, I'll just mention it over here. Maybe I'll just search if there's a diagram so it's easier for you to remember. Stages of behavior change. Yes, this is a good one. Right, maybe I should make it bigger. Open image in new tab. Right, okay. So these are the stages of behavioral change. You have, firstly, you enter here, you have pre-contemplation, which means that they don't have the desire to stop smoking at all. And contemplation is when, oh, I want to stop smoking, but there are these things that are stopping me from smoking. Determination means they are ready to stop smoking. Action means they are taking action. They are stopping smoking altogether. They are undergoing treatment, and after that, they might go into relapse. Actually, most smokers who try to quit go into relapse. But you should take this as a stepping stone, not as oh, I failed last time, I'm gonna fail again this time. No, it should be taken as, oh, I've tried last time, so I have the experience, and now I'm trying again so that I have less chance of failing this time. So it should be taken as I have experience in trying to stop smoking, and that experience will help me to be successful this time. So this is how you handle relapse. But so action, and then there's maintenance. So you either go into relapse or you go into maintenance. So you maintain your smoking cessation, so you don't smoke, which is what we are aiming for. Right. So assess the stage of change. So how do you feel about your smoking at the moment? So if they feel like, oh, there's nothing wrong with smoking, I smoke every day, everybody smokes, and it doesn't harm my health. Even if it does, it keeps me thinking, it helps me think, it helps me stay awake. These kind of things, they don't feel like changing at all. So that's pre-contemplation. Then, are you ready to stop smoking now? These are questions where you can assess whether they are in any of one of these stages. So after you ask this, you know which stage they are in, and you record the stage of change. Record either pre-contemplation, contemplation, determination, action, or maintenance. And then you assess nicotine dependence. Ask if there's any physical symptoms, withdrawal symptoms that you experience if you stop smoking. Headaches or tremors or whatever. Right. Next, you advise. All smokers should be advised to quit in a way that is clear but not confrontational. The best thing you can do for your health is to quit smoking. This is a very good example, so why not just take this as verbatim. The best thing you can do for your health is to quit smoking. Right. So after you assess, you advise, and you assist them in stopping smoking. So in this part here, they actually simplify the stages of change into 3 instead of the 5 stages here. They simplify into 3. That is not ready, unsure, and ready. So not ready is pre-contemplation, unsure is contemplation, and ready is determination. So it's just the same thing. So if the patient is not ready to change, discuss the benefits of quitting and risks of continued smoking. So you might get a heart attack, you'll get lung cancer, you get chronic obstructive pulmonary disease, which is sort of like asthma but in old people who smoke. And provide information about not exposing others to passive smoking. There's active smoking and there's passive smoking, and actually passive smoking is much worse than active smoking, because in active smoking they're inhaling the smoke through a filter, and in passive smoking the people surrounding them are actually inhaling the smoke that comes out the other end, the burning part of the cigarette. So that has much more harmful effects than active smoking. So you're not only harming yourself, you're harming the people around you, your family members, your kids, your wife, everybody around you. So next, you can advise that help is available when they are ready. So the quick line in Australia, for example. So in assist, if they are unsure, you do motivational interviewing. I did a video on that, but I'm not sure if I'm going to release it because there are a lot of errors on it. But motivational interviewing, yeah, you can read about it. I might link it in the description below for you to read about it on your own. What are the things you like and don't like about your smoking? So motivational interviewing, in summary, motivational interviewing is you just play the supportive role. You don't ask them to do something. You try and make them think of ideas of why they are smoking, what they want to achieve. So the ideas are coming from themselves. So in motivational interviewing, you empower them. Even if it's only 1 or 2 sessions of motivational interviewing, it's beneficial for them because they leave with their own ideas. And yeah, that's about it. Explore motivation and barriers to quitting. Explore motivation and barriers to quitting. Yeah, that's part of motivational interviewing as well. And offer written information, for example, quit kit and referral to quit line or tobacco treatment specialists. So refer. And if they're ready, affirm and encourage. So you tell them, yeah, you're making the right decision to stop smoking, and I encourage them to go through until the end. Try. Then provide a quick kit and discuss a quick plan. Quick kit. Wonder what quick kit includes. Shall we find out? So let's see. Right. Looks like nicotine patches and gums. I guess it's not a standardized quick kit. Yeah, it's a kit with lots of things to help you quit smoking. I'm not very sure what it is, but let's not go dwell into that. And okay, provide a quick kit and discuss a quick plan. Recommend pharmacotherapy for nicotine dependent smokers. See assess. Where is assess? Here. Assess nicotine dependence. Okay, so assess nicotine dependence. Here they have some information on it. Let's go through it. Assess nicotine dependence. Nicotine dependence can be assessed by asking how many minutes after walking, how many minutes after waking to first cigarette. So that's the addiction, the dependence part of your smoking addiction is due to nicotine dependence. Number of cigarettes per day. The more you need per day, the worse your nicotine dependence is. What cravings or withdrawal symptoms in previous quit attempts? What kind of physical symptoms have you experienced when you tried to quit the last time? Was it like headaches or tremors or shivering? Okay, smoking within 30 minutes of waking. Smoking more than 10 cigarettes per day and history of withdrawal symptoms in previous quit attempts are all markers of nicotine dependence. Pharmacotherapy for dependent smokers is proven to double the chances of successful quitting. So, if you assess nicotine dependence and if they have nicotine dependence, you offer both the supportive treatment and also pharmacotherapy, which I'll talk about in another video. So, okay, that's nicotine dependence. Recommend pharmacotherapy for nicotine dependent smokers. Next, discuss relapse prevention. How to prevent relapse. So there are two things you have to differentiate, which are the words relapse and sleep. So in relapse, for example, you quit smoking and you have already taken action to quit smoking. Let's make this. Okay, you have already taken action to quit smoking, and one day you go to the mamak, or you go to the bar or the cafe, and your friend offers you a cigarette, and you just take it, and then after that, the difference between sleep and relapse depends on after the first cigarette. So after the first cigarette, if you if you go back into your smoking habit, you can't stop smoking again, that's a relapse. But if you take that one cigarette and then you stop and there's nothing wrong, you don't feel anything wrong, you don't feel the urge to go and smoke, that's a sleep. So sleeps are okay, but relapse is what we are trying to prevent. And then after that, you offer referral to quitline or tobacco treatment specialist. So based on the stage of their readiness, whether they are not ready, they are unsure, or they are ready, you offer them different things, right? After that, after assist, you arrange follow-up. So we've done ask, assess, advise, and assist. Now we arrange follow-up. For patients attempting to quit, arrange follow-up visits if possible. At these visits, congratulate and affirm decision. So tell them, oh, you made the right decision and congratulations for quitting smoking. Review progress and problems. Encourage continuance of pharmacotherapy. Discuss relapse prevention. Encourage use of support services, or refer to quitline or tobacco treatment specialist. Please follow up, and after all this, they can either be relapse or successful quitter. Relapse. So what happens? What do you do when he goes back into smoking habit? Offer support and reframe as a learning experience. Yes. So when you go into relapse, it's not like you're a failure. The next time, don't think like, oh, I tried to quit last time, it was really difficult, I won't try it again. No, you reframe it as a learning experience, so that the next time you try to do it, you have experience, and there's a higher likelihood of success. If I'm not mistaken, for the statistics, the average number of times a smoker tries to quit before they successfully quit smoking is 18 times. So they go into relapse 18 times on average before they successfully quit. So tell them not to give up, try again. It's a learning experience. Explore reasons for relapse and lessons for future quit attempts. So you learn your lessons from here, and next time you try to quit, you won't make the same mistakes again. Offer ongoing support. Ask again at future consultations. And if they are successful, hopefully this is the goal. Congratulate and affirm decision to quit. Discuss relapse prevention. Offer ongoing encouragement for at least 5 years after quitting. Right. I think we missed out something here. So if they are ex-smoker, you ask and you know that they are ex-smoker, you assist here. Assist action and maintenance. Congratulate. Discuss relapse prevention. Review and reinforce benefits of quitting. Offer written information, for example, quit kit and referral to quitline 1378848 or a tobacco treatment specialist. So this number is only for Australia, so doesn't apply for other countries. Right. So in summary, ask our patients, do you smoke? Yes or no? You branch out over here. I think it's a good habit to refer to this chart here when you're trying to help someone quit smoking. Then after asking, you assess their stage, and based on their stage, you also give advice, and then based on their stage, you give different types of assistance. Whether they are ready, whether they are not ready, unsure, or ready, you give different types of assistance, and arrange follow-up, as this will help them to maintain their smoking cessation. Then relapse, this is what you do. If successful, this is what you do, and this is what we all aim for. Right. I think that's all I have for you. Thank you for listening.